we try to discuss about part of home remedies today. We try to discuss about emergency points in acupressure. What are the emergency points? So try to understand. There are four emergency situations happens in everybody's life. Yesterday I taught you the one mudra which is guaranteeing your heart for 100 years. That is Apana Vayu Mudra, Mrata Sanjeevani Mudra, which I taught you. You have to learn. You all learned it. You have to go and teach other people outside, right? Without expecting anything. Please do that. Okay. So that's some Aadhaar Foundation request. And also, secondly, today I'm giving you another emergency points. If anybody is suffering or you or other people, anybody is suffering from this kind of emergency situation, please use these methods. So I'm going to teach you, which is called emergency points in acupressure, especially for heart attack, epilepsy, stroke, and asthma. So what are those points, especially friends? So let's see these points, very helpful points. Okay. So these friends. So the first whatever the heart attack. The people who will be suffering with heart attack, who gets the heart attack, especially because of what? See, why the heart attack comes. So whatever the arteries which are carrying the blood, isn't it? The blood carrying through the arteries are closed because of high amount of glucose exists. That is lot of fat, lot of fats are already fats are coated within the blood vessels, within the arteries of the so-called heart. So that's why the amount of blood passage, the amount of oxygen passage to the heart would be reduced. So the amount of oxygen, fresh oxygen, which is going through the blood, it is going into the heart. So when that is reduced, the supply of oxygen is reduced, what happens? The heart muscles will get failed and heart cells will die. Then it leads to heart failure or so-called heart attack. So that's how it happens, my dear friends. Now, so in order to avoid that, especially, of course, mudras are there, and you have to eat the good holistic lifestyle, holistic food, everything you follow, this situation will never come. Okay, that's what we do in enema, and we do fasting. By fasting also, fasting itself, you'll be cleansing a lot of fat from your all the arteries, all the so-called veins of your particular veins through which the blood is flowing. You'll be able to clean all the unnecessary fats through the fasting. That is why fasting is a langanam parama aushadam, my dear friends. Now, so this heart, anybody who is suffering, suddenly, the heart attack start, that is chest pain start, palpitation start, sweating is going on, a lot of uncomfortable in the chest, right? So all this, shivering is starting. So a lot of vomiting, nausea, so many methods, headache, a lot of things are coming. So then what will happen is, if you are confused, then what will happen? So you must try to use one point I'm going to teach. That point is available only in the left hand. Okay, left hand backside you see on the left hand, this particularly the little finger, and the little finger, this nail is there, nail adjacent, one point is here, nail adjacent one point. Okay, this point only on the left hand, this is called heart attack point. If you keep pressing this, by the time the person is taken to the hospital, he will be survived, and the further failure of the heart will be stopped. And this actually, by pressing here 30-40 times, you are as good as you are massaging the muscles of the heart, especially the heart massage you are doing indirectly by pressing here. You are supplying, pumping the energy to the heart, so that the heart will be prevented from the failure of further heart attack. Everything will be stopped, right? So this is called heart attack point, my dear friends. Be careful and use this point. This is heart attack point. Okay, hope you understood this heart attack point. So this is the first one emergency point. Second emergency point, epilepsy. If anybody is suffering from the epilepsy, friends, this is a point. Here one point is there on the chin. Go and press it like this. This is 40-50 times. You can go and press. So which will take away person from unconscious state to conscious state. By pressing here, this is called epilepsy state. This is one of the emergency point. What are the other emergency point? Brain stroke. Why the brain stroke happen, friends? Again, so brain needs the proper the flow of blood and oxygen to the brain. When that pumping of the heart is not good, the pumping, especially the brain stroke, is not a problem of brain. It's a problem of the heart. The heart is not supplying proper amount of oxygen. The proper amount of blood is not coming to the brain because of the blood veins are blocked with the help of so-called cholesterol, the bad cholesterol, bad fat, all the fatty material which is coated inside the veins. Then what happens? Obviously, your veins are not carrying the proper amount of blood, proper amount of oxygen to the brain. The brain gets the clogs. the brain gets the clots. Inside the brain, clots will form. So once the clots are formed, what happens? So that leads to something called brain failure or brain stroke happens. When the brain stroke happens, what happens? The left side is completely, the left side is not working, right side is not working. So all this will come. So many side effects will come, my dear friends. This is called paralysis, brain stroke, all this will come, isn't it? So anybody who is having a brain stroke, so in order to identify them, whether they are got really stroke or not, just need to question three things. Okay, one is speech, tongue, and the rising of the hands. So you have to ask them, you have to say some words, ask them to speak. They can't speak. That is called yes. Yes is speech. So through speech, you can find out whether they are, got the brain stroke or not. Second, tongue. Ask them to put the tongue like this outside, like, stretching the tongue outside. They can't do that. That also, it means that they got the stroke, brain stroke. Third point of recognizing the brain stroke is the other one is actually, so after the tongue, then comes to the so-called rising hands. Ask them to raise the hands, right? Raise the hands and all. They can't do it because the signal is cut off from the brain. So that's how this brain stroke is understood, my dear friends. Now, so in order to avoid this brain stroke happening further, and also in order to take care of the time of brain stroke, what you are supposed to do. So we have certain points here. See here. This is the first, the on the both the hands. Okay, this one point is here. One point is here. So this point especially in the left hand. Left hand is a spleen point. The right hand the same point. Right hand also the same points here. Same point. This point is actually gallbladder. This is a spleen point. This also you can go on press at least for 30-40 times. This is one of the point on the left hand side, on the right hand side, both. But on the left hand side, spleen point. On the right hand side, this point is actually gallbladder. Both it will be pressed for 30-40 times. And also all the fingertips here, right? All the fingertips also must be pressed each for 30-40 times. These points are also related to the brain. Okay. So here, especially the thumb. See here. This is a brain. It's completely brain. Okay. All the brain points are connected here at the thumb finger. In thumb finger, you have pituitary gland, pineal gland, all the brain nerves, everything is here. Okay. So go on press here. 30-40 times. It's also very essential. It's going to help in both the hands. Okay. Now I'm showing on only one hand. So this is one thing, right? So with these friends, so what will happen is, so all these points what I explained now are the related to the brain stroke. Okay. So try to understand these points are very essential for the brain stroke to avoid to come out of it. So you hope you understood this one point, all the fingertips and especially thumb. On the thumb also, these continuously there are points here. Go on, press this thumb. So this thumb itself indicates the head portion and neck portion. Okay. So try to understand. So then follow this. Other than that, the final point is asthma. For asthma to reduce, why asthma comes? Especially the so-called the pipes, the windpipes taking the oxygen to the so-called your respiratory organs. It is not carrying the proper amount of oxygen to the lungs. Then what will happen? The lungs, inside the lungs, lot of phlegm will be accumulated. Then you start getting the asthma. You will not be able to walk for a long time and you'll be able to get tired faster. All this will happen. So that's why the asthma, in order to reduce the asthma, friends, here there is one point called the both the hands. There is one point here. This is called lymph gland. Here the lymph gland. That is, so here from two fingers, you put it like this, then put one point here. This point is called lymph gland. Okay. So you can see the picture in the part of the presentation I'll send you. But this point you need to press 30-40 times. Okay. This is called lymph gland. This is the asthma point to relieve the asthma. If at all asthma is increased, we can relieve easily by pressing this. Pressing is always like 5 seconds press, release. 5 seconds press, release. That's the method of pressing. Okay. Slow pressing. Slow and gradual pressure you need to apply. So this is called asthma point, my dear friends. These are the emergency points which we can use in a day-to-day life, my dear friends. So with this concept, with the home remedies concept, friends, we are finishing the today's the whole session. So thank you so much. So dhanyavad to all of you. Thank you so much for participating, patiently listening till this time.